Dr. Kris works with. You're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. All right, we're live. It's your favorite show, Peptides and Age Management with Dr. Kris of the Research Clinic. And Dr. Kris, today, how are you?
I'm great. How are you doing?
I'm well. It's been a while. We've been missing each other like ships in the night. You've been busy out hustling. Where you been?
We went out to LA, I think, since the last time we talked. Recorded a lecture out there. We've been kind of all over the place since then, just doing a little bit of, we took a vacation. That was one of the things. We were off a week for vacation. I was trying to remember what all I have been doing. And then last week we were just simply at our other facility that we go to once a month, seeing patients. So it's just kind of been, you know how the summertime gets, everything kind of starts running together during the summer.
Yeah. So, you've been working closely with Dr. Seeds and you have an announcement maybe you want to share with us?
Yeah, it's actually, I got a couple of announcements. I think they kind of go together. Is that I've known about it for a little while, but it's been officially announced that I've been added as a faculty member for the Dr. Seeds organization, SSRP. And so I think that's a really cool thing. There's not a lot of us that are faculty members. I joke there's 2 or 3 of us that haven't written textbooks. Everybody else has their own textbook. So it's kind of cool. Unfortunately, I'm not one of those people, but yes, I know, Steve, we need to write a book. He's been on me about that. I'm sure that'll be coming soon. But yeah, and then piggybacking off of becoming faculty, we're actually putting on the World Peptide Congress September 10th and 11th in Vegas at the Four Seasons. And all of the faculty members plus other select speakers will be talking for those 2 days. It's including myself. It's a peptide course that's really meant for anyone that's interested in peptides. You do not have to be a provider to go. And also it's for any providers that have interest in peptides. So the training that we go to every 3 months is what we call Mastermind. And that's what I'm part of the faculty of. And it's really for the provider has the general basis and understanding of peptides and wants to take it to the next step. This course that we're putting on in September 10th and 11th in Vegas is really meant for the provider that either has barely started with peptides or just has a real interest in it, or even just like I said, that they're expecting some podcasters and biohackers to be there. And then maybe just some general public members that just like, wow, I'd like to learn about peptides. So I think it's going to be a really good course. I actually have 3 of the nurse practitioners I work with actually going to the course because I've been trying to figure out how to integrate them into peptides. And I think this is going to be the perfect course for that. And it's not real expensive. It's actually in terms of what these things usually go for, it's only $400, which is not a bad price for the caliber of speakers that'll be there. So we're looking forward to it. We think it'll be really cool.
And then you're going to be a guest on Dr. Seeds' podcast as well?
Yes. And I should have had that date pulled up. August 3rd. I'm not sure that I think it might not be like ours live. I think it's recorded and then edited and then put out. So I would assume probably within a week of August 3rd. His is sex, drugs, and epigenomics with Dr. Seeds. And so we'll be on his podcast. Actually, I think probably the more proper term is we'll be running his podcast that week because I think I don't believe he's on it. I think we're actually just subbing in for him that day.
Well, there you go. Look at you stepping in for the big dog on the peptide.
Yeah, he's the guru, the man. So we're actually we're really delighted and actually just sometimes it's hard to believe that we're kind of starting to get to some of those levels. So we're just really excited to be taking. So we're just really excited where things are going.
All right, excellent. So just want to put this out there. These conversations are intended as educational. You should always consult your physician before changing your medical program. But we talk about great stuff here. You know, as most of us, we want to do better with our health. We want to do better with our diet, exercise, and we also are curious about what treatments are out there. Most physicians don't promote peptides because it's just not a part of their academic experience. And so these conversations I find are very interesting. Just to quickly, our topic today is where you get your peptides matters, but let's back up and just say, what is a peptide?
Yeah, and I would actually piggyback off of what you said with most providers. I would actually say that most providers don't know what a peptide is. So I would take it even further backwards. Hang on just a second. I'm so sorry. Patients texted me that need a quick response. One of my hospice nurses.
Sorry.
Okay. So I apologize for that. So most providers don't even know what a peptide is, but what is a peptide? It's a chained amino acid, a sequenced amino acids that cause a specific function within the body. As I always tell patients, and you've probably heard me say so many times, is that there are over 7,000 naturally occurring peptides in the body. And insulin is the most common peptide that everyone has heard of. We know that insulin breaks down sugars. And many of your new medications that are either out or in research for diabetes and oncologic diseases are actually peptides. And what we know about peptides is just, for the most part, peptides are so lacking of adverse events. They're extremely safe. And many of the peptides that we use, you can actually consider bioidentical because we already have these peptides within our body. So all we're simply doing with peptides in the hands of a skilled provider is we're trying to use peptides for the body to heal itself, as I tell patients.
Yeah. So now folks that are already into peptides, already value them, they're wanting to get them, either they're being prescribed by their physician, or maybe they're online trying to figure out where to buy them, where to mix them. And I believe that's why you wanted to talk about today where you get these really matter.
Yeah, so I actually I had this discussion at least once or twice a week. I actually just had this discussion yesterday with a couple of my patients that have been with me for a long time, and we started talking about peptides. And in this scenario, the patient had been getting their peptides through me, and then had quit using peptides through me, and then started getting peptides online, and then came back yesterday to say, well, those peptides, they worked for a while, and now they didn't work. And as I started kind of quizzing the patient on this, I quickly realized they were getting their peptides online. And what I mean by online is they're simply not using a physician-based pharmacy to get their peptides. And these peptides that generally patients can order directly simply lack the quality and purity that's needed to A, make sure that you don't have adverse events, and then B, get the results that you're looking for. And back in the day, the I believe it was IPS, International Peptide Society, actually did a little kind of mini study where they actually bought some of these different peptides from some of these different entities on the internet and actually had them tested in the labs for purity and potency. And it's a lot like what we talk about with supplements. The supplement market in the United States is not regulated. And they found that with these peptides that nearly all of them, if not all of them, had extremely low purity, and many times wasn't even the product that you supposedly were buying. And I just think that's really important to know. Like, if it seems too good to be true, it most likely is.
So when you talk about purity, a lot of these peptides you're injecting into just the fat layer. They're right. The purity is like super important.
Yeah, yeah. So I give the analogy like think of a brand name medication and think of a generic. Okay, so a brand name medication generally is going to be kind of plus or minus 2-3% of each bottle. In other words, if I took 100 milligrams of a branded medication and compared it to the next lot and the next lot, they should all be within about 2-3% of each other every time it's analyzed, and that's what's considered a branded medication. And then when something goes generic, they actually lower that to plus or minus 30%.
Wow.
So that's a big difference just in itself. So let's say something's got 100% purity or 98% purity. Now you're down to 70% purity. And I can relate this back to hormones because this is a discussion I have with hormones a lot. And patients saying, well, can I get generic hormones? And I'm like, no, because batch to batch, I can have a 30, actually kind of a 60% swing. If they were 30% on the low side this time, but 30% on the high side the next time, we can have a huge swing in the doses, and patients are all over the place with their labs and how they feel. And so that's kind of the analogy I use back to peptides, but it's even worse than that because most of these purities that we've seen with these peptides are more like 20% or 30%. And so you're just, you can take any form of a peptide and water it down. Like in our practice, we use Botox, of course. And I'm like, yeah, sure. You can water Botox down, but you're not getting the same concentration. And so that's how sometimes people get away with doing like cheaper Botox. It's the same way with peptides. And then most of the time when these peptides come in, they'll actually say on the bottle, not for human consumption. And I don't know what other people need to make them stop from using something, but I'm not injecting something into my body where I don't know where it came from, and certainly not injecting my body if it says not for human consumption on the bottle.
Now, these peptides, they're amino acids arranged in a chain, a specific chain, and should be being conducted in a what do they call the labs? They are
sterile.
Yeah, sterile, but also they're the pharmacies that are they're approved and they operate under.
Right.
Talk to us about
very specific guidelines. And so the pharmacies that we use, and there aren't a ton of pharmacies in America that are making peptides. There's only a handful that are credible, accredited pharmacies for doing this sort of thing. And so like we currently use 4 different pharmacies most of the time. There's a couple others that we sometimes will use. And so as I tell my patients, peptides aren't something that you can just call CVS or Walgreens and call it in. They have to come from these specialty pharmacies. And these pharmacies go through all kinds of inspections and accreditations to make sure that they're following the rules. And if someone were to say, well, how come more pharmacies don't do it? Well, it's because there's a lot that goes into being accredited to do this sort of thing. This is very specific compounding that only, like I said, specific pharmacies have the accreditation to do.
Compounding pharmacies. That's the word I was looking for.
Compounding. Yeah.
So these labs are they're inspected. They have to perform certain standards, but people are going online and they're ordering these things. And generally, these products are coming from other countries that may not adhere to these standards.
Yeah, and usually China. China is where the majority of these, or India, where these are coming out of. And you just you simply have no idea of what you're getting. It's again, I say it's just like supplements, like I tell my patients, I have to know that it's a quality brand. I have to know where it's coming from for many reasons. A, I don't want anything bad to happen to my patients. B, I want them to get results. C, if they don't get results, how do I know that they were even taking the right thing? It's the good news is once I sit down with my patients and just have a 5-minute discussion with them, generally they completely understand. It's, sometimes I'll use the analogy. It's like gasoline. Would you, somebody walks up to you and hands you a container and says it's good quality gasoline. Would you go put it in your vehicle? You have no clue where it came from. It's in an unmarked package. It says don't put in your car, but yet you go just pour it in your gas tank and expect everything to be okay. Chances are it's probably not. I like to break down things pretty simplistically, but I think it works for my patients to understand where I'm coming from with this stuff.
Yeah, so I've talked to folks, and some of these you can take them orally,
Hmm.
certain formulations. The others you have to inject, but you're not going to see like this immediate change. You need to take. Hopefully, you're taking a very good formula, and you're taking it in the right way, in the right. And these aren't just a once a day thing. Typically, we think we've been trained in this culture that you take a pill a day, or you take one a day, but peptides don't operate in this way.
Well, it's one of the biggest things. So, Dr. Seeds always says, it's one thing to prescribe a peptide. It's a whole nother thing to understand which peptide to prescribe, how to dose it, when to dose it, when to maybe change it out with another peptide, when to add to it. And that's whenever I always say, not only does the peptide matter, where it comes from, but the peptide you're using matters, and who's prescribing it matters. And there are a decent amount of really great providers in this country that know what they're doing with peptides. But this is a early on, pocket of medicine that we're doing here that, I just recommend that any provider maybe listen to this, or maybe someone talking to their provider about this, if they have interest, they need to get good formal education before they start prescribing peptides, so that they understand what they're doing, why they're doing it. It's just like hormones. I always go, the big difference is that separates like a provider like myself or people that I work with and from maybe other providers is it's great when everything's going well, but how does the provider react when something isn't going as planned? Do they know what to do? Do they know how to handle the side effects? Do they know what step to do next? And like I tell my patients, sometimes I don't. Sometimes it's like, hey, this sounds like maybe this, and we discuss it, and we're like, let's try this. Let's see how it goes. Of course, you have to have an open-minded patient sometimes for those things. Like my new nurse practitioner, we were talking this morning, and she was like, well, what blood test do you do for this and that? And she was talking about cellular medicine. And I basically said, so much of this doesn't necessarily have a blood test. So much of this can be history, physical, mainly just talking to your patients and really getting down to the root of what you feel like is going on. And then trying a safe form of treatment for these patients, possibly with a peptide, and saying, hey, if this is what the problem is, this is what the outcome that I expect to see. And let's try this for 60 days. Let's see how it goes. And you'll be surprised how many patients are really, really open to that, because what we're doing is totally different. The one thing that's really, really cool about what I'm doing is I'm getting more and more patients, when I say peptides, actually kind of have a foggy idea of what's going on. They're like, oh, I think I've heard you talk about those, or I've read about, I've had a lot of patients that are now looking up peptides and reading about peptides. Maybe it's from our podcast. Maybe it's just from steam gaining around peptides. But that's a really cool portion of what I'm doing now, of how many patients have actually don't look at me they have no clue what I'm talking about when I say peptides these days.
What I really appreciate is you can order a set of labs and get kind of a baseline. And over time, you can redo those labs and see the progress that you're making. And you're not just prescribing just peptides. You're doing some other comprehensive applications there. But that's a beautiful way to see that it's really working and not just, I think it is.
Yeah, there's so many different things. This is actually Maggie Woods, my nurse practitioner, and I were talking this morning. We have, inflammatory markers. Sometimes it's just subjective. If labs look good, I'm really happy when a patient says, Doc, I just feel so much better. I've lost weight. My libido's better. My sex life is better. My wife is happier with who I am as a person. But then many times those labs typically correlate with things improving. We see things changing. We, of course, have the true age DNA test, where we can actually look at a person's biologic age and versus their chronologic age. And with that test, you can actually repeat it down the road, and people can actually biologically get younger because of the things that we're asking them to do. And I think you made a really good point that I would stress, is that peptides aren't the majority of what we do. It's an additional tool in my toolbox. I still treat most of my patients, the majority of my patients, with simply diet, exercise changes, hormone replacement, and just healthy living supplements. And that works for the vast majority of my patients. Where we use peptides are those patients that despite those things, they're still struggling with different areas of their life. And that if we think, or a provider thinks they're a good candidate, those are areas where we can possibly integrate peptides into their program.
So when we think about where we're getting our peptides, what do you think are the most often searched for peptides online that people are trying to procure?
Which peptides are they trying to find the most typically?
Mm-hmm.
BPC, probably BPC 157, which the funny thing about that one is oral BPC, a medical grade, is over the counter now. And so, but people don't know that. And so they're getting, they're trying to buy typically injectable BPC or sometimes oral BPC. The growth hormone releasing peptides, the one that we've discussed most is CJC, ipamorelin, LL37 right now because of its antiviral effects with COVID, thymosin alpha 1. Those are probably going to be your most common ones, I believe, that patients are looking for. As I always joke, because my phone is sitting in front of me, there's one particular that advertises on Facebook that every time I say peptides 4 or 5 times shows up on my timeline later. And I think that's where the vast majority of patients are probably going, but through actually Facebook. Because, if you type in the word peptide on Facebook, or I think even Google, or say it, you're going to get these ads. And I think that's mainly where these patients are getting them. And they see the prices and they're so small that they're like, oh yeah, let me try that. But again, if you ever went into one of these labs and just saw it, we all understand that if you want to go buy a new Mercedes, if somebody says I've got a brand new Mercedes and I'll sell it to you for $1,500, something's wrong in the deal. And if you go into these labs, these sterile compounding labs, and see how many millions of dollars they have to put into their lab and their business, you would just simply know that they can't produce this stuff this cheap. It's just not possible. And so I just always say, if it looks too good to be true, it's most likely not true.
All right. So we've talked about it before, but folks that are listening or maybe watch this later, they maybe didn't catch that conversation. But tell us, BPC 157, what are the main things that it's impacting in our health?
So, as you've heard me say before, BPC 157 is made in our gastric juices in our stomach. It typically depletes with age, which is what a lot of peptides do. BPC, I like to tell providers it has a multitude of effects, but it really has a positive effect on the GI tract, which is hence why it's produced there. So it can be used for like reflux disease, ulcers, irritable bowel syndrome type symptoms of the gut. So GI is one of those big places that it can be used. And then also it has a neuroprotective side of it. So it can be used for the brain, for patients with neurologic conditions or patients that are just worried about overall brain function. We've even had some in the past, I've had some decent results like in tinnitus with it, like ringing in the ear. I've had some, which was nice because that's something before I had very little to offer my patients. And then probably one of its more common uses is actually the musculoskeletal system. It has a very nice anti-inflammatory effect on the ligaments and tendons. So can be very effective in like arthritis, just bad shoulders and knees, or acute injuries is typically where you're going to, one of those scenarios is typically we're going to be using BPC 157.
And then the CJC. Now, why CJC? Why should an older, maybe a gentleman like me, want to take this? What's it going to do for me? What's it going to do for a woman?
So CJC 1295, ipamorelin, those are two different products. And the first one, the CJC 1295, is what we call a growth hormone releasing hormone. And ipamorelin is called a growth hormone releasing peptide. So anytime a patient hears me say GHRH, GHRP, the most common form is CJC, ipamorelin for short. And basically, like I have the discussions with patients, there are some patients out there, not mine, but some that actually will get what we call exogenous growth hormone. It's basically where you're just injecting straight growth hormone. And there can be some real negatives with exogenous growth hormone. It's extremely expensive. The FDA has made it branded only, and a normal prescription is about $800 a month. Also, extremely hard for providers to write it legally. So that definitely changes things. But three can really, if you don't really need it, over time, you can actually hurt your own growth hormone production. And there's actually some side effects like insulin resistance, carpal tunnel syndrome that can be seen with exogenous growth hormone injections. So what we're talking about here is actually a peptide that simply works on the anterior pituitary gland in the brain to stimulate it to make more growth hormone and release more growth hormone. The nice thing about it is you're not getting too high levels of growth hormone because your body will self-regulate itself, but you're getting more what I call optimal growth hormone levels. And by getting more optimal growth hormone levels, because your body's simply being asked to make more and release more, you're going to get anti-inflammatory effects. So you're going to heal faster. You're not going to hurt as much after your workouts. You're going to sleep better. You're going to most likely notice your stress levels are better. You will get very nice body composition changes if you're working out and eating right. Nothing works if you don't follow those things. I always say you're not going to lose weight and have a better body composition and eat cheeseburgers all day. But, you'll get less fat, increase muscle mass, which is so important as we age. But those are just, I always like to say a GHRH, GHRP, you might think of it as a workhorse of peptides. It just does a little bit of everything. You feel better, you sleep better, you look better. You don't ache as much. So those are kind of some of the highlights of what a GHRH, GHRP would do.
We got a question here. So Sarah, Rosie's asking Sermorelin versus Ipamorelin.
Yeah. So Sermorelin is basically a grandfather to Ipamorelin. So nothing wrong with Sermorelin. We still occasionally use it. It's a little bit of a less expensive product. And so actually let's back up because you actually asked a part of the question I did not answer. Really has the same effects in men and women. So, that part doesn't really matter. But I would always prefer Ipamorelin over Sermorelin if I can, simply because I find that it's a more effective product simply because it's a little more refined, a little cleaner product. But if a person's doing well on Sermorelin, or if that's what they have access to, or that's what their provider is comfortable with, there is nothing wrong with starting with Sermorelin. So anyway, it's just, like I said, it's a little bit of an older product than Ipamorelin.
Excellent question. So tell us, I think the thing that really helped me is when I envisioned that these are signaling agents. They're telling our parts of our body to produce more of what they used to produce.
Right. Yeah. Again, we're just trying to use these peptides. Again, I hate to be like repetitive, but this is again where being a provider that understands what they're truly doing is so important. Because we're trying to just use peptides to have the body heal itself. I'll actually put it towards the topic that I'm doing in Vegas is erectile dysfunction for men, obviously for men, well, and women too, I guess, but in a roundabout way. The problem I have like with a Cialis or a Viagra for men is not that they're using it, but that if you're an aging male and you're using Cialis and Viagra to increase blood flow to the penis, eventually, most likely, those are going to quit working because the blood flow problem is only going to get worse with time. And eventually the medication can no longer fix the problem. Whereas if we use like a pulse wave, like we've talked about before, we can recreate blood flow, create new blood flow, and actually fix the problem, which is what we're kind of trying to do in the body with peptides. So we're not trying to mask something or cover up something. We're actually trying to rectify something and fix it. And so that's just kind of how I try to explain peptides to a patient versus a true medication. Like you're a diabetic and you go into your doctor's office and they say, Steve, you're a diabetic. Take metformin to bring your blood sugars down. Well, is that curing your diabetes or lowering your blood sugars? And it's the latter. But if we ate right, if we exercise more, maybe if we instituted some peptides and hormones, we could fix the diabetes. So we probably do need the metformin, at least temporarily, but let's also have a game plan on how to actually solve the problem if possible.
Okay, so thymosin alpha 1 is another popular one that folks are looking for. Can you tell us a little bit about that?
So thymosin alpha 1, one of my favorite peptides, produced in the thymus gland in the neck, helps our body. And again, it's another peptide as we age that decreases with age. We're trying to use this peptide to modulate the immune system. And we always very particularly use that word because we're not trying to, as you and I've talked about, we're not trying to make the immune system hyperactive. We're simply trying to make the immune system react more appropriately when it needs to. So if someone were to get exposed to a virus or a bacteria or a fungus or whatever, hopefully your immune system will recognize it quickly and react quickly and then back down to zero. So I always use the sports car analogy. Hopefully your immune system can act like a Corvette or a Maserati or something where you step on the pedal, RPMs go up, you win the race, and then the race is over. You're back down to 1,000 RPMs or whatever, and you can just idle there like you want to. Because if your immune system is at full tilt all the time, it's going to end up playing itself out and going to cause lots of damage down the way. So thymosin alpha 1, an extremely safe peptide. It helps in production of our T cells and B cells, which is the basis of our immune system.
Why is it that you cycle these? Why is it that you don't just take it every day?
Well, and thymosin alpha 1 is one that I actually believe people could take either on a daily basis or twice a week. Most of the time we dose, most providers dose thymosin alpha 1 twice a week. But it's actually one that I believe can be used all the time. Sometimes cycling with peptides is simply a cost issue. So if I'm trying to gain something for a patient and maybe I want them to be on 4 different peptides, but financially they just can't afford that, sometimes I'll use 2 peptides or 1 peptide and say, okay, I want to use this for a certain amount of time. Let's just take thymosin alpha 1, for example. Let's say it's a cost issue and we have them on thymosin alpha 1 for a while. I do believe that we can get them to the point like charging a battery where, okay, we've used this long enough. We've used it for a few months. I believe the immune system is going to be able to hang in there for a few months without the thymosin alpha 1, although I'd love for it to stay on board if we could, but financially we can't. But now want to move over to this next peptide and use it for a couple of months so that we can get this effect that we need. So, and then other times we only want to stimulate it so much. There's a lot of different reasons to cycle. I just find the most common one being in my practice, typically financially, is one of the biggest reasons that we're cycling peptides.
So how hard is it to find a physician that is familiar with peptides and can work with you?
It's a good question. I think the best way for a practitioner, for a patient to find a practitioner that is well skilled in peptides is probably to start through like SSRP. I think you can go to their website. I think it's actually seeds.md or ssrp.com, I believe is their websites. They can Google SSRP and find it. I know that you can actually put in leads through there and they will route you to the nearest certified SSRP provider. I also, of course, work with BioT. I help train the BioT providers on peptides. They could certainly go through a BioT provider. Not all BioT providers do peptides. So you could probably just, go to biot.com, which is BIOTE.com, and then put in your zip code and then call your practitioner that's nearest you and say, do you do peptides? How comfortable are you with peptides? And I think that when patients go in to meet their provider, they should interview them a little bit. I don't mind that at all. I get patients less than I used to because I think because of everything I do now, they feel more comfortable with me when they come in. But I don't have an issue with patients asking me credentials. I actually like it because I spend a lot of money and time training on what I do and getting these credentials. So I'm kind of excited when someone shows interest in, hey, doc, what's your training in peptides? Because I've got a good answer to that. So I don't mind it at all. But I think that those are probably the two best ways that I would go about it, trying to find a provider that is capable of handling their peptides issues or questions.
All right. This has been excellent. So what's one peptide that you think most women, other than the 3 or 4 that we discussed today, what's one that you sometimes consider for them?
Most common is going to be CJ Cipamarelin. Second is going to be the BPC TA1. I know we've already talked about those. Thymosin beta 4 would probably be another one. That's one of my favorites as well. It's definitely in my top 5 of peptides. Again, it just comes back to, actually, I can answer that one. The definitely in the top 5 would be the 5-amino-1-MQ, the oral peptide that blocks the enzyme pathway NNMT, which basically raises our intrinsic NAD levels, which NAD is the precursor or what pushes us to make ATP, which is energy for our cells. So
name that again.
Say that again.
What was you went fast. So what's the name of it?
5-amino-1-MQ.
Okay.
Yeah, I know. My nurse practitioner asked me earlier, why do they have to have such crazy names? Like, I don't know. I don't come up with the names. But 5-amino-1-MQ, and it blocks the NNMT pathway, throw all those letters together. Dihexa is sometimes another one for my aging females that I like a lot. Dihexa is the peptide that really can be used to help with higher learning and just overall thoughts and mental clarity. So really and truly, what I would say is I don't know that I separate peptides into men and women. I separate peptides into what's going on with the patient. It's one of the nice things with peptides is for the most part, I don't know that we're altering our peptide regimen a whole lot in a man versus a female. It's not like hormones. We all have the same peptides. So that's kind of a nice thing is because it's one of the things that freaks providers out about hormones is they always see women as very complicated when it comes to hormones, and they're a little more complicated, but not too bad. But with peptides, you can kind of just think of it. I don't really think of them any differently whenever it's male or female.
When I search online for peptides, I do a little research. Most of it is cosmetically, there's a big high people want to put it on their skin, and which is very different than what we generally discuss.
Yeah. And actually at Mastermind, Mastermind Dallas is next. Then we have Mastermind Beverly Hills in October. And that one's actually, I guess it makes sense. We're going out to Beverly Hills and we're doing a whole cosmetic mastermind conference out there. But, one of our most common, probably, if I had to say, our most commonly sold peptide in our office is actually Luminate, which is a topical cream for decreasing line and wrinkles and increasing collagen. Simply because it's over the counter, it is and it works fabulously. It's mainly using GHKCU, which is the copper peptide. It actually in medical studies had about a 33% reduction in lines and wrinkles and an increase up to 70% in tactile strength of our collagen fibers. So it's a pretty amazing peptide that ladies or men, it's not just ladies, so men or women can just apply it on their face, neck, chest, hands twice a day, and about 90 days later see a pretty significant response in their skin quality. But yes, so many peptides are out there in different makeups and things like that. Again, the problem with those is that I believe most of those over-the-counter makeups and skincare, I guess is what I would call it, like not pharmaceutical grade, like what we have in our office. You just don't know how much of a peptide is really in it. What is the quality? It goes back to the first part of our podcast here today. I just simply, if I can't prove it, I can't trust it. And so that's why I'll only buy peptides from, and sell peptides over the counter to my patients that I know where they're coming from and the quality of those products.
Okay. And then let's just talk about ketone esters right quick.
Our favorite. Actually, this morning was taking my ketone esters before our workout, and I said, I think I'm tricking my brain. I said, it actually, this batch tastes better than the last batch. And my trainer tasted it and he goes, nope, just as bad as the last one. And so like, maybe I'm finally desensitizing to the taste of ketone esters, but as we always joke, it's a horrible tasting product, but it is a fabulous product. And if you can get past the taste, the good news is you only take very small amounts. You typically for women, 5 cc's and men 10 cc's. And as we say, it's the most potent fuel for your cells that you can have. Ketone bodies is basically what ketone esters are. And you're giving your cells instant energy and instant fuel for mental clarity, for your workouts. I like to call it a great pre-workout, but it has no jitteriness or caffeine in it. So you don't have to worry about, there's really no contraindications that would stop you from taking ketone esters. So of course we get our ketone esters from ketoneaid.com. If someone were to go there, just put in research and they'll give you expedited shipping for free. And we also do have it in our office, of course, for our local patients that want it. We do sell it in our office.
All right, great. So stay tuned. Dr. Kris is hosting Dr. Seed's podcast here in a couple of weeks. And we got the World Peptides Congress coming up September 10th. What else is on tap, Dr. Kris?
I think that's it, except that we are still actively here at Research. We're actively working towards getting our Nashville location open. We're hoping still to have Nashville open at some point later in the year. Just everything in COVID has taken longer. I know everybody's tired of that excuse, but the license took forever to get because no one worked in the office. And now we've hired Maggie here at the office. And to my local patients, I'm not going anywhere. I just am going to try to set up a shop in Nashville. We really hope to have that up and running maybe in about October, November. We're headed there in 2 weeks from today to try to go down and get everything finalized. And actually, total sidebar, personal note, one of our good friends has actually got the, what do you call it, Indy racing. His race is going to be through downtown Nashville in 2 weeks. So we're going down there to do that, but also for 4 days, watch the race through downtown Nashville with the Formula One cars. So it should be kind of cool. So I guess that's what's on tap right now. We got a lot of moving parts. We're working towards things. I think if my patients will hang in there, I think they're going to think a lot of this stuff is pretty cool. And so we're just trying to help patients the best way we can. And we're actually really trying to help other providers. That's probably where my biggest new movement is towards with being faculty now with SSRP and all the things I do with BioT is training other providers is probably where one of my biggest missions is right now is to do that.
Yeah. So if you have a physician that you would like to kind of connect with Dr. Kris, you can reach Dr. Kris here at theresearchclinic.com. He enjoys talking to physicians and helping them get introduced to this. This is the future medicine, the cellular medicine.
Absolutely.
Helping each of us improve our cell health. So which improves just works on the rest of things. And you've been watching Peptides and Age Management with Dr. Kris Wusterhausen of the Research Clinic. And again, these conversations are intended as educational, and always consult your physician before changing your medical program, and just have that physician reach out and talk to Dr. Kris. Any last words, Dr. Kris?
No, and I just want to reiterate it. I really do enjoy talking to other physicians. I do it weekly. And so I just would, if a provider really does have a question, if they really do have an interest, feel free to email me at Dr. Kris at the Research Clinic. You can call the office. They'll get me the message. I will call you back. We can discuss it. I'm just really enthused at how many doctors I'm getting to talk with who are actually really open to this kind of medicine. It's really cool. Young, older doctors, it really doesn't seem to matter these days. And I tell you, when they see their patients getting better, they're like, okay. And they kind of start getting into it. So just, if somebody has a question, holler at us.
All right. Good job. That's a wrap. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast.